Hello everyone, this is Stephen Shaw from the Chang'an Memorial Hospital. Our team leader, Professor P.J. Zheng, and our team members would like to introduce the device we invented, which is called non-invasive cervical ring medical device. The purpose for this non-invasive cervical ring is to prevention of preterm labor, and the whole project is funded by the MOST Taiwan. The abstract, what we would like to show you is a unmet need in the maternal fetal medicine. Because the preterm birth rate is globally increased, like around 10%, which means 1 in 10 pregnant women has a problem with the preterm labor. So the reality is cervical insufficiency or cervical incompetence. This is not an uncommon disease and can cause preterm birth or miscarriage. So our intervention is to do the comparison between the new device and the traditional cervical sacrilege. The cervical sacrilege, including the abdominal cervical sacrilege and transvaginal. The most traditional way is we using the transvaginal way, but which is an invasive procedure and require anesthesia and a surgical technique. Also, it needs admission for tocolysis for like 1 or 2 days. The new strategy is we using the cervical ring device, which is a novel, non-invasive cervical ring. We're using a ring to cover the cervical outer cervix, and like we tightening and to prevent the cervical opening and to prevent the preterm birth. The technique here is in the left-hand side. We use the device divided to 2 parts. The first part is cervical belt. It's using a rubber. The wide length is 60.0 millimeter and thickness is 1.0 millimeter, and distance is 25 to 30 millimeter with the 147 millimeter length of the belt ring. The instrument device is using the stainless, the first one in a prototype. Later on, we will use a single use and could be the disposable one. So the instrument devisement, including the first outer sheet and the second outer sheet. Then we have the first inner tube and second inner tube, and first handle and second handle. It's divided, it's all included in a one set. So we put cervical pads in front of the instrument device. Then we do the procedure. It's a single-use medical device. I will introduce a quick movie later on to show you how to perform the device. So this is non-invasive cervical ring. It's easy, feasible procedure. No need for admission in hospital, no anesthesia. And a GP or general ONG doctor can perform this device in the outpatient clinics easily. For the pregnant woman, they feel more tolerable and acceptable. So our novel core technology and the milestone. So we are going to show you the non-invasive cervical ring core technology and the lab data. It's including the stress analysis. The stress analysis, we're using the ring, the rubber ring. The ring covers the stress weight, including the fetus and the uterus, and also the amniotic fluid. So the downward forces try to open the inner cervix and outer cervix. The ring, we cover that and the tightening that, so we can prevent the stress from the uterus or from the fetus. The simulation and analysis is also be done already. We simulate the test performed by the doctor to compare a pull and resistance in the traditional sacrilege. What is the traditional sacrilege? As I mentioned before, it's using the surgical technique. We need to do that in the theater and do the anesthesia, and we expose the cervix, outer cervix. Then we use the needle to puncture a couple of stitches, and we tighten down. This is quite difficult and surgical skill based. So the simple one, we we invented and introduced you today is the much easier one, using the device and with the rubber ring in front of the device. And you can do that in outpatient without any admission or anesthesia. We also do the effectiveness evaluation to using the ultrasound to do the pre-test and after surgery. Pre-surgery and after surgery, we measurement the cervical length, and also the pre-device and the post-device to make sure the difference of the cervical length before the procedure and after the procedure. So this is a quick movie I would like to show you. You can see the black one is, you can image it as a cervix, outer cervix. And the device and approaching the cervix, and this is the inner sheet and inner tube. So we tightening that, and we put an outer sheet and outer tube to tightening the cervical ring, as you can see that. Then we release that, the first one and the second one. So the procedure looking so easy and quick. The normal core technology and the milestone. The first one is industry analysis. The clinical report regarding the cervical security market. In the global market, global industry analysis and the size, share, growth, trend, and forecast 2017 to 2025. The global market is increasing because, as I mentioned, the global preterm birth rate is around 10%, and it's still increasing because nowadays we have a lot of IVF cases and a lot of twins, even triplet. For the multiple pregnancy, the preterm birth rate is likely over 40 to 50%. So the future discussion limited in the suture material and the surgical instrument. Based on this analysis, there is no replaceable medical device in the market nowadays. So our invented and novel device could be a good source for the market in the future. The second, the medical needs. The incidence of the preterm birth and early abortion is increasing globally. However, the medical provider, especially O&G doctor, is insufficient to cover all the medical needs in the world, especially in the Africa and some place it's not enough doctor to cover all the medical needs. So our easy and non-invasive cervical ring could cover up the unmet needs to prevent the preterm birth and the prematurity of the newborn. The third one, the replace. The novel cervical ring has less invasive, less anesthetic risk, less expense in the hospital compared to traditional security. So in a post-COVID-19 era, symbolize is the procedure in a new trend in the vertical innovation. So the core technology of non-invasive cervical ring is the key of the first phase industry in the prevention of preterm care. So our business, as you can see, we have 4P: product, place, promotion, and price. So the first upstream and the downstream analysis of product market supply chain. So we got feedback improvement based on the users, the first phase users, and we have the therapeutic effect, and we satisfy the doctor and the patients. Then also we need the FDA approval in Taiwan, China, UA, and EU. And also we have intellectual property protection. So upstream product development, including the B2B. The first B is like our company. The second B is in the hospital, is a B2B service. And B2C is B to pregnant women. So the marketing in Taiwan and other countries. The third one is downstream marketing entry. So the medical education is very, very important in every angle. Especially we need a medical association to teach the young staff how to use this single-use device in everywhere, every aspect to do the medical education, to make sure every doctor can perform this device easily. The last one is commercialization. This is no medical insurance covers initially. So the target end price is $500 USD each set. This is single use. So we need to do the comparison between the traditional cervical sacral in the left column and in the right-hand side is the non-invasive cervical ring. As you can see in the surgery, which the one is invasive versus outpatient. So it's non-invasive. For the admission, in the traditional one, you need to do the admission. In the non-invasive, it's no need for the admission. And for the anesthesia, of course, in the cervical sacral one, you need to do the anesthesia. But for the non-invasive cervical ring, you don't need to do anything. And you don't have wounds. The risk of infection is very low. And you don't need to do the, if you want to do the removal of stitch, if for the traditional one, the cervical stitch is difficult to remove. But for the non-invasive cervical ring, you can easily to take out the rubber ring and the cut and easy to take out. The operation is shorter, the skill difficulty is lower, and the tolerance for the patient is higher. So the feedback from the early adopter and the leader user, they got some recommendation, including can change the treatment model of cervical incompetence in the future, and can lower the entry level for the doctors who need to treat cervical incompetence, and decrease the incidence of the preterm birth rate in the world. And ultrasound can detect the shortening of the cervical length. They also have some suggestions from the first leader user and adopters. They suggest if you can synthesize the procedure, and also the set should be combined together firstly, which means you have the rubber ring and you have the medical device. Then you provide this device in the set. And the best way is you provide this set and combine together. So you don't need to do the first attachment. You have the attachment initially already. The third one, they suggest should have a device to dilate the vagina and help insertion of cervical ring. The traditional way we use is which is called vaginal device to dilation. So some doctors, they suggest have a more non-invasive device to dilate. Something to replace the speculum, and which is more easy and more comfortable. So our milestone in the 2023, we have the companies called GenTap medical companies. And we would like to enter in the clinical trials in Taiwan, China, and USA. In the year of 2024, we need to do the Taiwan FDA approval, and we apply the ISO and the GMP. And the product is in production and in the market already, and start to be available everywhere in Taiwan. And in the last milestone in 2025, we will have the FDA approval from China, USA, and EU. And we have marketing in China, and we have international partners. And maybe the last goal is IPO. Thank you very much.